When the pandemic hit New Jersey was just coming out of a long era of austerity. Under the Christie administration, there was massive tax cuts. We had very little resources to respond to the pandemic in a way that would help those who would need the most help.
Imagine not being able to visit the doctor when you start to feel symptoms because you're scared that you will be faced with insurmountable medical bills, that you will be turned away because you don't have insurance, that you will be turned away because of something as simple as your immigration status.
We may make policies as though the pandemic is over, but the case numbers suggest otherwise, and the economic indicators suggest otherwise. So we can't just stick our heads in the sand and pretend like there's no pandemic.
There was massive inequality before the pandemic. I think the COVID-19 crisis highlighted a lot of the inequities, so I think many more people became aware of those inequities, and it also built upon and exacerbated those existing inequities.
These are systematic things that we created through public policy and that we can, resolve through public policy.
NJPP is a bit of a unique organization. We are a think tank, that we call ourselves a think and do tank, and that's because we don't just do research for the sake of doing research. We don't just produce reports so that they can sit on a shelf and collect dust. We do all those things so that we can achieve real change for the people of New Jersey.
NJPP is a progressive think tank that moves forward progressive policy based on immigration, healthcare, economic opportunity, and tax policy that is more equitable and fair. To push progressive policy in Trenton, New Jersey requires pressure on legislators. And that's done through the press, it's done through advocacy organizations, it's done through everyday people calling and pressuring them.
NJPP released a blueprint in 2017 that was filled with important progressive policies that would advance racial equity and economic justice for all of New Jersey. 4 years later, we're happy to say that the vast majority of the policies in that document have been accomplished. Everything from $15 minimum wage to paid sick leave to healthcare expansion, making sure we have representation for individuals facing deportation, and a whole host of issues when it comes to tax and budget policy to ensure that we have an economy that's working for everybody and that everybody's paying their fair share. And so now when we were coming to 2021, we were thinking about, well, what do we need to accomplish over the next couple of years in New Jersey? We decided this time to work more closely with our partners, and that required having conversations for a vast majority of a year with over 30 organizations that we work closely with on a daily basis to determine what are the biggest priorities that remain for the most vulnerable communities in the state of New Jersey.
This blueprint reflects a longer-term vision of what we need New Jersey to look like. If we care about folks being able to support themselves, to be able to care for their families, to be able to get to where they need to go, to access the health services that they need, and more. The blueprint is a guiding plan to be able to ensure that.
The blueprint impacts every single community in this state, whether or not you are experiencing adverse outcomes of policymaking.
We have put that document together. It is the blueprint for a fair and just recovery. It has over 60 policies that represent the needs of various communities throughout the state, especially communities of color.
If every policy was enacted that's in the blueprint, we would be a state that clearly values everybody, no matter where they are, and offers them tools to get ahead. These are like massive investments in making sure that families can live a whole and productive life.
This is our state.
This is our house.
This is our recovery.
This is our blueprint to get there.
Because going back to normal isn't good enough.
Let's get to work.